Hello, my name is Victoria Monroe, and today I wanted to provide some information on what you can do to keep yourself and others around you safe during the COVID-19 pandemic. Today, we will go over how COVID-19 is thought to have spread and things you can do to protect yourself and others, including cleaning your hands often, avoiding close contact, covering your mouth and nose with a face cloth when around others, covering coughs and sneezes, and cleaning and disinfecting. You will learn how to effectively complete these tasks and why it is important to do so. COVID-19 spreads from person-to-person contact. This is between people within about 6 feet. It also spreads through respiratory droplets, which can be produced when someone infected coughs, sneezes, or even talks. These droplets can then be inhaled by people nearby. Symptomless people can also spread COVID-19. Medical experts and studies have suggested that there may be symptomless people out there spreading the virus, so you might not even know that you are sick and you could be spreading it to other people. The first thing that you can do to protect yourself is cleaning your hands often. Wash your hands with soap and water for at least 20 seconds. This is especially important if you have been blowing your nose, coughing, or sneezing, and after you've been in a public place. If soap and water is not available, use hand sanitizer that is at least 60% alcohol, which makes it more effective. We should be avoiding close contact. Practice social distancing. Just because you feel good doesn't mean you cannot spread the virus. Don't be hanging out with friends in person right now. You want to be part of the solution, not the problem. The goal is to flatten the curve so hospitals don't get overrun with patients. If that happens, doctors and nurses will be unable to provide the best possible care, which can lead to a greater loss in life. Another thing you can be doing is wearing a cloth face mask when around others. It would be great if we could all use surgical masks or N95 masks, but those should be reserved for people fighting COVID on the front lines. This mask is meant to protect people from wet respiratory droplets from your own coughing, sneezing, and breathing. You can find these materials for free at your own home. You just need an old t-shirt, some scissors, and rubber bands or hair ties. A reminder that these are not medical masks, so they are not to substitute social distancing. I attached a video from the US Surgeon General making a do-it-yourself face mask. We should be doing this anyway when there isn't a pandemic going on, but please cover your coughs and sneezes. Use a tissue or your elbow when you cough or sneeze to prevent the spread of respiratory droplets into the air and onto surfaces. Afterward, wash your hands and make sure you are throwing away tissues and cleaning surfaces that might have been exposed to droplets. Lastly, we should be cleaning and disinfecting commonly touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, and whatever you can think of that you touch a lot in your house. First, you want to clean visibly dirty surfaces with soap and water before disinfecting. Most EPA-approved household disinfectants will work, along with bleach and alcohol solutions over 70%. I also attached a link on how to dilute bleach and alcohol solution and more information on disinfecting. Now we're going to answer a few questions about this presentation. The first one is, can you spread COVID-19 without showing symptoms? So take a couple seconds and choose an answer for the question. So the correct answer is B. Yes, COVID-19 has been suspected to be spread by asymptomatic people. Which of the following cannot be used as a disinfectant? Take a couple seconds and answer. The answer is C, soap and water. This is not strong enough to be a disinfectant, it just sanitizes. True or false, you can spread COVID-19 by simply breathing on someone. Take a couple seconds and answer. Okay, this is true. You can spread COVID-19 by breathing on people. This is why the CDC and other health organizations are now recommending the use of homemade face masks. Thank you.